Welcome to the Modern Day Naturopath Podcast with Dr. Sue. Real talk for those craving deep healing whilst living in a modern day society. You'll be equipped with knowledge to make profound mind-body shifts that utilize ancient wisdom and will facilitate your healing once and for all. Inspired by Dr. Sue's chronic illness journey and all the real and raw pearls she has learned along the way. Come as you are. It's never too late to start.
Welcome back to the Modern Day Naturopath Podcast. I'm Dr. Sue, and today we're going to be speaking with Dr. Cait Strong on the topic of fertility. Dr. Cait Strong is a naturopathic doctor based in Connecticut. We met in naturopathic school almost 10 years ago in Arizona. I absolutely adore her. She was a great friend of mine. We also were involved in the same mentorship. We got to know each other really well, and she specializes now in fertility. So I want you guys to press pause and go to Instagram and please follow her at dr.cait. So it's dr.Cait, C-A-I-T. I wanted to bring her on and talk about fertility today because people seeking out holistic options for fertility seems more prevalent than ever. I thought it was an absolute perfect fit to bring on Dr. Cait so she can shed her knowledge in this area. So thank you so much for joining us, Dr. Cait.
Of course, I'm so excited to be here talking with you today. Thank you for having me.
Of course, I am so happy too, and I would love you to tell everyone a little bit more about yourself.
Absolutely. So, I live in Connecticut with my husband and 2 kids. And as you said, I'm a naturopathic doctor and a functional medicine provider. And I've been in ND now for almost 10 years, which is so crazy that we graduated almost 10 years ago, Sue.
Wild.
Wild, right? Um, but yeah, over the years, I've come to specialize in helping women who are dealing with fertility issues to be able to get pregnant naturally through a holistic root cause approach.
So you shared with me you also have a membership I'd love for you to share called the Get Pregnant Naturally membership. Can you share more about that with us?
Yes. So it's a virtual fertility program. And like you said, it's called the Get Pregnant Naturally membership. And basically, it helps women to heal their infertility at the root cause level so that they can get pregnant naturally and more easily. So, we all know someone who has had trouble conceiving, right? Infertility has become so common, unfortunately. I think the statistic now is about out of 8 couples struggles to conceive, which is just
Wow.
heart-wrenching. Yeah. So I started this program because I want women to know that there is a way to get pregnant naturally without having to do IVF, without having to take medications with all the side effects if you don't want to. Because of course, if you want to go down that conventional route, I absolutely support that choice and you should. But I just feel that, I talk to a lot of women and a lot of them that I've talked with, either they've already gone down that route and it hasn't worked, or they're looking to avoid it if possible. Um, and so, I'm just so passionate about helping women to know that they can heal their fertility, and I want to show them how to do it. And so that's what I do through my program. I basically walk those clients through the step-by-step process to work on those deeper root cause issues, and turn their infertility into fertility. I know it's been my passion project for years now. It's definitely been an adventure.
Yeah,
And
I love how you said passion project.
oh yeah. Yeah, I really do. I mean, I've spent many, many hours into creating the materials and, you know, trying to make it really applicable, not just like information, you know what I mean? Um, and I think I just keep going and going with it because I just know how needed it really is. And I feel like so many women are looking for things like this. Like they want to take a holistic approach. They just don't realize that these strategies exist. And I guess you could say that for just naturopathic medicine, really in general, right? So, everything that we do, I think people get it. Like this is what people are looking for. And so I feel like just so grateful to be in this profession.
People don't even know that some of these things are options, right?
I
Like you
know.
or you don't even know it exists. And whether you decide, right, to do something conventional and or combine conventional with Eastern or, naturopathic methods, or decide you just want to go with naturopathic methods. Some people, like you said, they just don't know these options exist. And that's why I'm so happy talking about this today, because I feel like it can help women in any phase of where they are in terms of preparing. Some of my patients say, hey, 5, 10 years from now, I want to have a child. How can I start preparing my body now? Or, hey, in the next year, or hey, in the next 3 months. I feel like no matter where a person is, we can always come in and intervene somehow and help with our natural intervention. So I definitely want to talk about all of those today. I'm so excited to do so. And I also wanted to ask you, do you did you always want to do fertility when we were in school? Because I don't remember that you were, the fertility gal and that's all you wanted to do going forward. Did you decide that after school, or did you decide that while you were in school? Because I don't remember that.
No, you're totally right. I definitely didn't want to, or it's not that I didn't want to specialize it with it in school. I think we were just so focused on graduating and passing all the tests. I really didn't think about specializing at all. I just wanted to, be the best naturopath that I could be and graduate. um, so but yeah, you're right. So the first few years that after graduation, um, what ended up happening was I worked at a really busy insurance-based practice where I saw a lot of patients with many different conditions. And then over time, I just naturally started to see fertility clients or patients, and I realized that I loved working with them. And it slowly became this big passion of mine. And I think that that's because I find it so rewarding to help them to be able to get pregnant. And also, I know that the work that we do together, especially during that preconception time, is then going to influence the health of that child in a really positive way. And that is super motivating to me to know that those kids are going to be healthier for the long run because of what my clients or my patients are doing during that prenatal and pregnancy time.
Exactly, right, and helping generations to come, right? Not only them, but I mean, we can literally, I know it sounds, cliche, but you literally can change the world, right? If you're helping all these women and then helping their babies be healthier, I think about all of these now healthier children for decades to come and centuries to come after, right? So it's like a ripple effect of just health that just keeps going and going and going, right?
Absolutely. And we're seeing so many sick kids. It seems like kids are sicker than ever, and the United States is sicker than ever. So I feel like this sort of holistic approach is really, truly needed.
Absolutely. And I want to ask you too, from all of your experience, what would you say are the biggest hurdles to patients getting pregnant from your experience? And I kind of want to go through, if maybe you can kind of list off some of the main ones you see, and then maybe we talk a little bit more about them. But I'd love to hear what you see as one of the biggest challenges that come up a lot with your patients or that you see time and time again.
Yeah, I'm so glad you asked this question because talking about root causes is one of my favorite topics for sure. So for every patient, of course, it's different, but I think that underlying hormonal imbalances that are not being properly identified or addressed are number one. So, for instance, hypothyroidism, low progesterone, and with that, often a short luteal phase, PCOS, or estrogen dominance. All of these things can interfere with ovulation, implantation, or really just in general, the ability to conceive and then to carry the pregnancy. So, I find that these imbalances are often going undiagnosed in conventional care. I think a lot of times it's because the woman has a regular cycle and the their hormones might be tested, but it's usually just like a one-day snapshot, and it's not telling you the whole story, right? So that's and I'm sure we'll go into this more, but that's why I find a full hormone cycle map to be so valuable because it gives you that full picture of what's really going on instead of just relying on that single day hormone blood test. So Yeah, I mean, I think that really for any woman that has quote unquote unexplained infertility, I really think that there usually is still a hormonal imbalance going on. It's just that their doctor is missing it, and they're not doing it intentionally. It's just that they're not trained in that way to be ordering these full cycle maps.
Right. So they'll say, yeah, these are normal labs. And I want to definitely, this is one of my favorite topics is the comprehensive testing. So we'll talk more in detail about that
Mhm.
soon. But they'll say, yeah, everything is normal. But in my perspective, it's like, well, if you're only testing one or two things, then of course everything is normal. Or what are the ranges that they're looking at or
Mhm, mhm.
but I wanted to, 'cause I thought this was really important what you just said, and I wanted to repeat this. So when I asked you what were the biggest hurdles, the 5 that you said, and I want everyone to really think about their history here. You said hypothyroidism. So
Mhm.
functioning thyroid is a huge culprit she sees with patients getting pregnant. Low progesterone, a short luteal phase, PCOS, and estrogen dominance. So yeah, I absolutely agree with you. Those are really strong contributors to fertility or infertility challenges. Can you share a little bit more about what you mean by a short luteal phase and maybe talk to people about what is a follicular? Like, what's the number of days in follicular? What's luteal? Because I have noticed over the past 10 years, I still can't believe it's 10 years that we're doing this.
I know.
Every time I still count, but it's crazy to me how many women, and crazy because I didn't even know this before I had to start testing this either, because we don't get education on what is day 1 of our period? Like, what day 1, okay, day we bleed, right? Some patients don't even know what day 1 is, so then if there's track, follicular, or luteal, they're so confused. So, can you just do, like, bare bones basics for our ladies out here? Because I get this question almost every day. What is day 1? What is 1 to 14? Like, how do you count follicular versus luteal? And then maybe talk about why a short luteal could contribute to fertility challenges?
Yes, sure. So for the follicular cycle, the first half of your cycle in an ideal case would be the follicular phase is 14 days, and then the second half of your cycle would be the luteal phase, which is also 14 days. That's in like a textbook, quote unquote, normal
Mhm.
um, hormonal profile. But what I see happen is that, well, first of all, you need to know that the luteal phase, so the second half of your cycle, actually, let me back up. So your follicular phase is when, the egg is getting ready for ovulation. Then you have ovulation in the middle of your cycle. And then the latter part of the phase is supposed to support pregnancy with the idea that, after ovulation, then comes implantation. And then you need progesterone in the latter part of your phase to support implantation and the growing fertilized egg. Um, so what I see happen is that the second part of the cycle is too short. It needs to be at least 10 days. And I'm seeing that the follicular, the first half of the cycle, is too long, or maybe they're both too short, but that the luteal phase is too short. And if you don't have a long enough cycle, implantation cannot occur. And it usually coincides with low progesterone levels.
Mm.
So that in of itself is a really important finding, but then we have to ask, why is that happening? And actually, I'm working with a really wonderful patient now, and this is exactly what's going on with her. And, she's done IVF in the past. She did conceive her daughter through IVF in the past, but they want to have another baby again. So we started working together. And what's really interesting to me, and I'm actually finding this more and more, is that the reason for, I would say the most suspected reason for the um, short luteal phase low progesterone is actually because of estrogen dominance in the first half.
Okay.
So estrogen will affect the receptors essentially of the progesterone.
Okay, that makes sense.
So it's almost blocking it. Yeah.
Yeah, those one I was always curious if that's exactly what right, because it could be long, but right, what's the reason? And that explanation was amazing. I'm so happy that you just went through that, and I'm gonna literally take this piece out and make sure we have a really good clip on Instagram for women to listen to over and over and over again, because those few facts about like basic female menstruation and how we do have two phases, and this is when we're supposed to ovulate on day 14, but not everyone does that. And when does it start? This is so
Hmm.
important. So thank you. That was a perfect explanation. And also, if you're counting too, Dr. Cait, so day
Hmm.
one, I just want to remind our ladies, right? Day one is the first day they bleed,
Yes.
red
Yes.
blood. So, right, if you're counting, you always start, because my women always ask me, well, I spotted brown a little bit, but that could be
Hmm.
something when they're low progesterone. You agree? Like when they start spotting before, but you do start counting on day one when they are actually bleeding.
Right. Red blood. This,
Okay. Red blood.
yeah,
Okay. I wanted to make sure you agreed with that. That's super helpful. And what about the role of environmental toxins on our hormones? And how often do you see that being the case for some women?
totally. Environmental toxins, I think, are a huge factor, affecting our health in general in this country, right? But absolutely affecting fertility in both men and women. So we definitely need to be considering endocrine disruptors, things like BPA, which is found in plastics, phthalates, which are used in personal care products and plastic, pesticides in our food, heavy metals. All of these toxins can mimic estrogen or interfere with hormones and disrupt ovulation and reduce egg quality and reduce sperm quality too.
Hmm. And do you ever tell patients if they want to that they could test? I mean, sometimes depending on their finances and maybe they just
Hmm.
want to detox them, which would still be helpful. But some patients happen to want to know a little bit more in detail to the toxins that they have. But I personally, I don't know if you've used this one before. I've used the Total Tox by Vibrant, or I think even Great Plains has a environmental panel. But I just wanted to share with you guys that there are panels that you can actually find the toxins that you actually have. And then why is that helpful? Because there may be things that you're being exposed to on a day-to-day basis that you don't know that you can then prevent, right? That could be then causing more issues down the line. But I did want to just share, I think I told you this before, Cait, but I had this patient who she was not able to get pregnant, and she went to a naturopath, and it was pretty shocking because the naturopath even told her with her low estrogen and her low AMH that she would need an egg donor. But I did not agree. And I was pretty shocked that a naturopath would say that without really digging a little deeper. And she ended up doing an environmental panel, and she had uranium in
Wow.
results.
Wow.
Lord, when we detoxed that uranium, she got pregnant a couple months later. It was, I mean, we were so happy because where would we have known she had uranium? And we had to do a very specific treatment for that. And it had to be done when she was not trying to conceive at that point. And she had to make sure, because of course that's dangerous to try to conceive when you're, dumping these toxic compounds, right, into the kidneys and liver, and that will affect the baby. So we made sure she was being very safe about pregnancy, detoxed her properly, and then waited a little bit of time after, and she tried to conceive and she got pregnant. I think now, yeah, her baby, I think, is almost 2 years old. So I wanted
Oh,
to share that story because it just touches me to this day. And just by looking to see what her environmental toxins were, really, that was her root cause.
that's amazing. Did you guys ever did she figure out where the uranium was coming from?
Oh, that's a great question too. So I was like, where the heck is this coming from? And I had a med education session. So some of the doctors or some of these companies will offer the appointments to chat with them about the results, and they're experts. And so I shared, and she grew up in Iowa and said there was supposedly, I think it was either in her water supply or something with the drops. Don't quote me on that, but I can look back in my notes. But I do believe it was something she was being exposed to where she was. So it was something like her childhood house or something, but this was probably stored in her for how long? And it was crazy because her entire Dutch panel, which we'll talk about later for hormone testing, she was just low, low, low. It was like low,
Mm.
right? Because these toxins are endocrine disruptors and can really lower these hormones. So I just that story to this day still gives me chills because you just have to sometimes think outside the box, right? If we're doing all these naturopathic things and they're not seeming to shift, is there something a little bit more that we can do or test to get there?
Absolutely. I totally agree. That's so amazing that you took that approach with her. Thank God.
Love it. Love that story. Yeah, I had to share it with you guys. And also, Dr. Kate, can you tell us more about emotional health, spiritual health, stress, trauma, and how those can impact us on a fertility journey?
Definitely. Just really quickly, I just want to touch on, like I know I had just mentioned before how hormonal imbalances are often what I'm finding, why women can't get pregnant. But I also have to ask myself, well, why does that woman have those hormonal imbalances? And so to me, there are three main root cause categories. And emotional trauma and stress and nervous system dysregulation is absolutely one of them. And then the other I would say is environmental toxins, like you had just mentioned. And then I think the third is nutrition and nutrient depletion and that sort of thing. But if we're going back to the stress piece and, um, you know, traumas, I I think that for many women, addressing these emotional or energetic quote unquote blocks that could be coming from trauma can be the key to changing their fertility. Um, so, okay, so if we're talking about trauma, let me give you an example. I worked with a really amazing client, and I love to tell this story because it was really just so incredible. But she had been trying to get pregnant for years, and they had done multiple cycles of IVF, and she had miscarriages um y- and nothing, it seemed like nothing would help, and she also seemed really healthy. And so working together, we uncovered a trauma that she had gone through in childhood, and we both felt like it was contributing to her fertility now. And then we did EFT together, which is called emotional freedom technique. And basically it's tapping, but it's going through that memory and allowing the body to release the trauma of the memory. So you won't forget the memory, but the effects of the trauma on your body are released. And within 2 weeks of doing the EFT together, she was pregnant. So
My God,
I know it's really amazing. Um,
that's so
I
amazing.
know. I think that it's really different for every person, but I would not underestimate the mind body stress connection because it's a real thing and it is strong. And so often, the key is really to dig deeper and figure out, you know, is there a trauma going on? Or if you're really stressed out, how can we change that on a deeper level? And I also know that for any woman looking to get pregnant or who's struggling to get pregnant, the last thing that they want anyone to tell them is that stress is affecting their ability to conceive, or the last thing they want to hear from anyone is like, just relax. So I totally get that. But I think that um, we can't underestimate the role of stress because it does raise your cortisol levels, and then that will affect your progesterone and your estrogen levels too. Um, so for my patients, I really want to help them understand the importance of helping their body to get into a relaxed or a parasympathetic mode as often as possible, because I do find that a lot of fertility clients are in like a hypervigilant survival mode state. And if your body doesn't feel like it's safe to, conceive, like if it feels like it's being chased by a bear, it's in sympathetic mode all of the time, you have really high cortisol, like it's not going to, on like this deeper level, it's not going to feel safe to conceive. Um, so yeah, so getting into that parasympathetic state becomes really, really important.
Thank you so much for sharing that, because I don't think people realize how much their stress is affecting them, because they go to the doctor and they get told that the only reason they're sick is because they're stressed. And while stress is absolutely a cause for so many things, there are usually other things underneath that. And that my patients end up then getting so annoyed by hearing that it's just stress, that then they're undermining when we say, hey, can you control your stress? But we're also telling them to eat well. We're also telling them to take their vitamins. We're also telling them to balance their hormones. So the stress component is really, really important. It's just, do you agree that most doctors will just turn around to their patients and say, yeah, it's just stress, right? Like there's nothing else going on. And have you ever met a patient where it was just stress and they didn't have maybe a vitamin imbalance, or something was off in their labs? I personally haven't, because I've usually are seeing the aftermath of stress on their body, right? Like if you're going to go through long-term stress, you're going to have them, particularly maybe some vitamin deficiencies. If, for example, your anxiety is making you not have an appetite, or there's going to be some hormone imbalances because you've been in high cortisol. But do you agree that they're going to the doctor? This is what I hear. I'm just kind of curious if you hear this, and they just hear that it's just stress. That's why when we, say, hey, in your fertility journey, reduce your stress, they get annoyed because they're just told by their doctors that all they have is stress. Do you know what
Mhm.
I mean?
Absolutely. And and I think also, to your point, stress affects everything. And it absolutely is affecting the gut too. And so, you know, if like look, talking again about say estrogen dominance, you have to ask, well, why does the patient have the estrogen dominance? And yes, it could be toxicity and these outside exogenous estrogens getting in the body, mimicking estrogen, blocking the body's estrogen, but it also could be from dysbiosis. There's certain bacterial markers in the gut that are breaking down estrogen. And if those are out of balance, then um, you will have an imbalance in your estrogen. And then that's going to affect your ability to conceive. But then you have to ask, okay, well, why do you have that imbalance in your gut bacteria? And for sure, stress can absolutely be affecting your gut. So, yes, I think that it's just that ripple effect, that domino effect where your nervous system, adrenals, trauma, stress, it's all one big bucket to me, really, um, is affecting everything. And in some ways, it's almost empowering because it gives us, a blueprint, like it gives us a direction to know that if we work on that part, if we work on that category, then it's going to also in turn have a positive ripple effect on your gut health, on your hormonal health, on everything else.
Absolutely. Exactly. And I think too, even when we kind of take the pressure off of ourselves with the fertility, especially women who, they're trying to get pregnant, they wanted to get pregnant yesterday, and
Mhm.
stress and building up, and I'm supposed to be pregnant. And I wanted to share, Dr. Sparks actually had a patient who was, she came to her for fertility, and we want to be clear that in our practice, we tell people we're not necessarily fertility experts, in the sense of fertility is not something we do every single day, and that we're helping women every day with just that concern. But by getting them healthy, right, they usually end up can get pregnant. And so we have gotten lots of people pregnant. We just don't advertise that. And we made that very clear to the patient, like, we're going to help your body so that you can get pregnant easier. And this patient ended up doing a cycle mapping, and she was so focused on the cycle mapping Dutch panel, and she's normally very, very stressed, that she just quit collecting every day, and she wanted to make sure she collected properly. That then she was like collecting for over 30 days, and she's like, what the heck is happening? I didn't get my period. And she ended up getting pregnant because she was so focused on getting pregnant, and all she needed was a little distraction, and that so just her making sure she peed on her strips the right day, made her she distracted herself, and then her stress went down. So
Were you working with her before that? Maybe the other things you were doing with her were
Yes, and
helping?
that too. So I think Dr. Sparks said it was like iron or something. Like she was just low in yeah, like some of these patients can just have simple fixes too. I think she was low in iron, right, which is so vital in fertility. But I think it was like some stuff she was doing before that, of course, kind of worked on her system, and then all of a sudden, but it was crazy because they weren't even working with each other longer than like a couple months. You know what I mean? So I think
Mhm,
they had just anticipated it taking longer,
mhm.
having that distraction. So I just wanted to mention that because of the stress component. And then I love emotional freedom technique, the tapping. I just did it with my patient the other day on even just on a regular virtual call because she can't stop looping about, I mean, she's not a fertility patient right now in the sense of she wants to get pregnant now. She eventually wants to get pregnant, but she has like looping, obsessive type compulsive thoughts. And we said, okay, let's just start tapping. So people can utilize tapping for free by going to YouTube and they can just learn the tapping sequence, and or you can go to a naturopath or an EFT practitioner and then they can guide you through a tapping session. So I just wanted to mention some of these trauma type techniques. So the EFT and also EMDR could be wonderful for some people, somatic therapies, right? So there's all of these that could be important to work on people's trauma, childhood trauma, adulthood trauma that's affecting their fertility. And the other thing I wanted to ask you, because we tend to sometimes forget about the partner,
Mhm.
the husband's sperm. How common is this a challenge, or is this a problem in the patients that you're seeing, or just in general?
Yeah, absolutely. I know I've been talking a lot about the women, but that's probably not fair because it's estimated that male factors contribute up to 40 to 50% of all infertility cases. So,
30 to 50?
yeah, yeah. So the male is really a crucial part of the fertility equation. And obviously, it often gets overlooked, or at least it does, I think, until the couple, is going to um like an IVF clinic or looking at IUI and actually testing the sperm. But I think that, it's a simple test. And I think that if you're not sure about your partner's sperm, that you should just have it tested. There's just no harm in having it tested for sure. Um, yeah, but I think for just like for the woman, the prenatal time matters for the guy too. And in an ideal world, he's eating a nutrient-rich diet. He's taking a great supplement plan. He's reducing his stress. He's avoiding toxicity. Yeah, I think that we should definitely talk more about how male fertility is such a contributing factor to this whole equation too.
Perfect. Okay, we're going to go into that. Before we do that, I wanted to also ask you just the last couple quick questions in the hurdles that patients are having with fertility. What about vitamin deficiencies? So, do you see a lot of vitamin deficiencies? Which ones are the most common? Why is it important for us to test those?
Definitely, I think that vitamin and nutrient deficiencies are one of the true root cause components of infertility in both men and women. And it's stemming, unfortunately, from diet. And, there's just so much processed food out there now, and our soil is not what it used to be. So there's a lot of different reasons, but nutrient deficiencies can affect everything from hormone production to your menstrual cycle and ovulation to egg and sperm quality for sure. So more specifically, I know that everyone knows about folic acid, which is vitamin B9, and I think a lot of people know about how important it is to have vitamin B12. But I find that one of the overlooked vitamins for fertility is vitamin A. And that's because it's really essential for the production of progesterone, which is essential for getting pregnant. You need to have healthy progesterone levels. And vitamin A is really important with egg development. And it also helps to maintain the integrity of the endometrial lining. So that's crucial for implantation. Um, so yeah, vitamin A is really important, and it only comes in true food form. It's really only coming from animal sources, especially of fat. So I think that if you're vegan, I think that vegans just are going to tend to have a harder time getting pregnant because they are naturally going to be more deficient, and you really have to make sure that you're taking a really strong, uh, good prenatal vitamin if you're vegan. Um, and then the other vitamin I wanted to talk about was vitamin D, which is, I think, also overlooked. I don't know, maybe are you finding that more and more patients are interested in their vitamin D levels too?
Now they are, I feel, more than ever versus years ago because it was a specialty test. Like their doctor wouldn't even do it. Their medical doctor would be like, no, you don't really need that. And now the medical doctors are doing it more. So I think it's becoming a little bit more mainstream or streamlined. What do you think?
I agree, but I am finding sometimes insurance doesn't always cover it, which is frustrating, but it's such an important vitamin.
I know. I don't understand it. Well, it's really unbelievable that you mean vitamin levels that are essential for, I mean, what is it? I think it's for vitamin D, it helps with over, I think it's like 2,000 or I don't know, something like cofactors in our body for, so many different things. It's actually like it's actually a hormone and then it's not covered by insurance, but it's very, very sad.
Yeah, yeah. If you want an almost instant way to boost your mood and energy, start
Yeah.
taking more vitamin D, right?
Yeah.
Or work with someone who can test your levels so that you can get the right amount.
Yeah, and even I wanted to ask you too, it's super interesting about the vitamin A. Well, it
Yeah.
makes sense too, right? Because it's an antioxidant, right? And it's
Mhm.
also important for fertility. But I remember in school, we got taught about certain vitamins and minerals for pregnancy. And can you confirm for a woman trying to conceive or a woman who is pregnant, they should not be taking more than I think it's 5,000 IU of vitamin A?
Yes. So I think this is a little controversial, and probably any medical doctor listening to me would maybe shake their head at that. But I think that it really matters if it's synthetic vitamin A versus coming from a natural form.
So let me ask you something. So the vitamin A we would get in some of the doctor grade supplements or like even like a Genestra emulsion.
Mhm.
Consider that a synthetic versus if you would you call a food different? Like so what would you call synthetic? So you're talking about like for example, if I have a patient who's trying to conceive and I'm adding up all of their supplements and their prenatal, of course we give really high quality superior absorbable vitamins for them, right? They're not getting the synthetic ones that they just get from their pharmacy, right? As prenatal, we get these really good prenatals, and then I make sure I count up that there's no more than 5,000 A in those. You're saying in your perspective, if the person is getting food sources of A, well, so supplemental A, they're not supposed to have more than 5,000, right? So you're saying if they're eating a food source, they can eat more vitamin A in the source of food versus that 5,000 in those supplements? I just wanna make sure I'm understanding.
Yes, yes. So I think that in my understanding, the research behind vitamin A toxicity, um, affecting pregnancy is controversial. However, to be safe, I still personally would never recommend like a vitamin A emulsion, like you said, like the Genestra product. Like I would never put a prenatal or pregnant patient on like a vitamin A product like that. But I
Mhm.
think that so vitamin A in its natural source is coming from animal fat primarily. So for instance, if someone is cooking in beef tallow and you're going to be getting vitamin A from there, or like taking cod liver oil, like I think that that's all safe for pregnancy, and I would not recommend discontinuing that just because it contains vitamin A.
Okay, I see. So to be clear, the reason they usually tell women to not take more than 5,000 IU is because it can cause birth defects in the baby, but we're thinking that if you're already taking a 5,000 supplemental vitamin A, make sure you max it at that because that's through a supplement, but then from Dr. Cait's perspective, which makes total sense, from a food source, that wouldn't necessarily be, you know, contraindicated because it is coming from food. You're just not trying to take a ton of supplemental A. Right?
Hmm.
Is that what we're saying? Okay.
Exactly.
That makes sense. Okay. Okay. So you said so far vitamin D, vitamin A. Are there any other ones that I missed?
Well, I think probably all the vitamins are
Yeah, they're all
important
important,
in
right? It's
some
just like
way.
which ones can be really but thank you for sharing that about vitamin A
Yeah.
because people don't talk about that enough. They're just talking about vitamin D, right? They're
Hmm.
not talking about A. And what about gut challenges and hurdles? Have you seen women who are also trying to get pregnant having issues with their gut in the sense of are you doing some testing or are you just doing, listening to your symptoms and then saying, okay, I think this is what's going on, and then supporting their gut in that particular way. But how can the gut relate to fertility?
I think it absolutely relates to fertility. I think it's foundational in hormonal balance, immune function, nutrient absorption. I listen a lot to Dan Kalish, and I he said something that really struck me. He said, we all learn in school how the gut is the foundation to your health. And then and then he said, "So why aren't we running gut panels on every single patient?" And I thought, exactly. Like, that is so true because even if someone isn't, having crazy gut symptoms, so, for instance, with my fertility clients, they might not necessarily be having a lot of gut symptoms. I think usually they have some, but I am really seeing imbalances on their GI map, on their stool tests. And I'm seeing how stress is affecting their gut. I'm seeing an imbalance in beta glucuronidase, which is then affecting their estrogen dominance. And then when your gut is imbalanced, that's going to affect your nutrient absorption, and those deficiencies then can be affecting your egg quality and ovary function, could be contributing to a miscarriage risk or pregnancy complications. So, when the gut is compromised, basically, if you have symptoms at what I consider the bottom tier level, which would be symptoms like hormonal imbalance or thyroid dysfunction or fertility challenges, I know that underneath that is likely gut dysbiosis or a gut imbalance in some way because the body has this hierarchy with its physiology and the gut influences everything.
Absolutely. That was perfectly said. And with the part that you said, it doesn't always have to show up as a gut symptom. Like some patients don't have any gut symptoms and they have an autoimmune disease. And I
Right.
say, we have to check your gut. They're like, but I don't have any gut symptoms. Then we check and then they have all these gut bugs. And we're like, well, that's why you likely are, it's what's contributing to your autoimmune disease. So I think that was a really important point that you don't have to just fertility could be a symptom, like having fertility challenge be and I hate sometimes using the word infertility because it just makes people feel inherently broken almost.
Yeah, it's a label and
I
yeah,
say right? I try to say it in different ways because I feel like once someone puts in their head, "I'm infertile," I feel like just them feeling that is enough to make it hard for them to get pregnant. So I try to say fertility,
totally.
right? So, if you're having challenges with your fertility, that may be your symptom that is telling you
Right.
need gut panel. And I think I saw one patient who, again, no gut symptoms, but she had H. pylori, and H.
Mhm.
pylori creates a low stomach acid environment. And therefore, if you don't have your stomach acid, you can't absorb your vitamins and minerals. And so, just by having H. pylori that comes up in a stool panel, working on that can absolutely help someone's fertility. So you have to really think outside the box. And this is where naturopaths shine in a sense of they're actually spending time with you and figuring out what's underneath this. Or let's just say, how we were taught in our mentorship, it's like going back before age 10, right? Going back in their history. Did they have gut symptoms when they were younger, right? Were they given drugs or were they taking, did they take a lot of antibiotics? Did they get a lot of steroids? Did they, a lot of patients say, oh, yeah, I had food allergies a ton as a kid. That can even say, oh, look, I don't have gut issues now. But then you look at their panel and you see a deficiency of all the good bacteria or you see overgrowths of things. So I'm really happy that you said that. sometimes it's just starting with the stool panel. Do you like the I particularly use either the Genova GIFX or the Diagnostic Solution GI Map. Do you like those?
Yes. In general, I love Genova, and I do run a lot of Genova tests, but I tend to mostly run the GI map.
Yeah, me too. I actually really like that one. I used to do Genova for many years and I have nothing against them, but I just recently started doing GMAP over the last 3 years. And I don't
Mhm.
know, something about how concise the results are
Yeah.
makes it less overwhelming for the patient and also even for me to read it to them. I just feel like that has been what I've been leaning toward. But again, they're both really great companies. And I wanted to also ask you, in the topic of preconception care, which I'm really passionate about too, people think that, you know, they can just all of a sudden, let's just decide we're going to have a baby tomorrow. And while that may work for some people, we do encourage for the health of their pregnancy, the health of the baby, like we were talking about before, to do preconception care. And I love for you to talk more about, how do you make new egg and sperm in that kind of 3 month period so that you can actually influence the sperm and egg to now be at a different place 3 months ago that it was now, right? So, can you tell us a little bit more about preconception care, when we should do it, why it's important?
Sure, sure. Yeah, so I think, I hope for anyone listening that they don't feel stressed out about this and instead that you feel empowered. But the idea is that we are constantly affecting our reproductive health, especially with our eggs and sperm. So, whatever we're doing now, what in terms of nutrition, nutrient levels, gut health, toxins, stress, all of that is affecting the quality or really just overall our eggs and the egg that will be released within 3 months. So, in other words, you can have a large impact on the egg that is released in 3 months by what you do starting now and then over those next 3 months. And the same concept applies for sperm and for men. So, I hope that listeners feel that it's really like an opportunity to boost your nutrient levels, to take supplements, to work on your nutrition, to lower your toxicity, knowing that those changes are going to help your health and your fertility in a positive way.
Yeah, I love how you said opportunity. And that's why we want to make sure you guys are, like Dr. Cait said, are empowered and just know this is here for your education. This is not to say, oh, now I blame myself. I should have done this. I shouldn't have done this. When we know better, we do better. And now you might be like, wow, preconception care. I never heard of that, but this actually sounds like something I would want to do. I didn't even thought of this before because the GYNs are not really bringing this up, but it makes perfect sense. It's just an opportunity, like you said, to be able to be in a healthier place, both the female and the male, so that, of course, then this sperm and egg could be of top-notch quality, right? And they can feel great through their pregnancy and this will affect their child after that. And so do you have patients start with certain prenatal vitamins before? And obviously the dietary stuff, we have everyone do at least in a preconception care. That's probably number one, right? The stress management, the dietary changes, nutrient rich foods. They could do testing at this point, right? Oh, look, I'm low in these vitamins. I got to add this in. Oh, my thyroid's off. Let me do this. Oh, look, these gut bugs are coming up. Let me work on this. Or I have leaky gut. But are there any vitamins or supplements you would recommend that people start before? Of course, if they come up with deficiencies, you want to make sure everyone is addressed differently and individually based on their labs. But do you have people do prenatals before, and that length of time before they're trying to conceive? And what time do you think is best to do that?
So to me, being on a fertility supplement plan before getting pregnant is like preparing the soil before planting a garden, right? Or it's like making sure your house has a really strong foundation before building it. You want to make sure that your body has all the nutrients it needs to create healthy hormone levels and the healthiest environment possible for conception and a good pregnancy, right? So to answer your question, I think the sooner the better. But ideally, I want to start patients on a fertility boosting supplement plan at least 3 to 6 months before trying to conceive. But of course, again, like the earlier you start, the better. Even if it was a year out, that would be amazing. And I recommend different things. I think that some naturopaths are not keen on recommending a ton of supplements, but I think I don't like to mess around with fertility. I would rather my patients take like a really strong supplement plan, to be honest with you, and cover all my bases than to skimp on them. So for sure, I want them taking a really great prenatal, and I often recommend a food-based one, but I definitely want to make sure that it has the methylated folate and the active B12, so the active forms of vitamin B9 and B12. And then going back to vitamin D, that I also think is non-negotiable. And typically I'll recommend magnesium too. Yeah. As far as vitamins go, I think that those are the three main strong ones that are really important.
I love that. So basically what you're saying is the sooner the better, but it's never too late to start, right? So
Absolutely.
you
Yeah,
can
even if you're pregnant now, I would start now for sure.
yeah, exactly. And when I send out this podcast, what I will do is I will put the link to some of the because people will, message me on social media or even patients who were patients of mine in the past. They feel great, but now they want to get pregnant. What do I take? I basically put together just a prenatal pack of what you just said. So I have there the prenatal vitamin, the vitamin D, the mag, and then I also threw in there, and they can take these two. I threw in there like a probiotic and what's the other one? Oh, and like a prenatal DHA or some type of fish oil, right? So you could take some of these, all of these, anything is better than nothing, right? So I agree with you. The stronger the supplement protocol, the better. And when it comes to testing, we talked a little bit about the GI map or Genova stool panels. We talked about a little bit before about the Dutch, but I happen to use the Dutch the most on women who are, just having hormonal concerns, those who also want to get pregnant. Do you use the Dutch a lot? Do you like the Dutch Complete versus Cycle Map? What are you using in terms of hormone testing the most?
Sure. So when I want to assess how stress might be impacting a woman's cycle, I tend to go more towards the Rhythm Plus, which is the Genova test, because it tests estrogen and progesterone over the whole cycle, plus testosterone, plus the cortisol and DHEA. So you're getting the adrenals and you're getting melatonin and you're getting estrogen and progesterone. So I find it to be a really amazing test. However, I do also like the Dutch. So that I choose more, I think, if I am thinking that, estrogen dominance is an issue and I want to see how those metabolites are. I also like, that I know like with I think there's a Dutch Complete, which would have, it's more expensive, but then it has the B vitamins, the organic acid markers showing us B vitamins, glutathione, neurotransmitter metabolites. So I think honestly, both tests are really great. And it kind of just comes down to the patient. And, to be honest, both tests are an investment in money. I don't know exactly how much they are right now off the top of my head, but I find that the insight that we get from them is to be so invaluable. And as a result, it saves time, it saves money, and it saves emotional energy in the long run. So I can't say that I can make any patient, do the test, of course, but I think if you're struggling with your fertility, that sort of information, knowing what your hormones are doing over the whole cycle is just so invaluable. And it allows us to create a plan tailored specifically to your body's needs on that deeper level because we have this concrete data about the patient.
Exactly. And it's like, especially if you have a time frame you're trying to do something in, sometimes it's just worth the investment. You can look and say, okay, I'm going to do this without testing for a year, or I'm going to find out exactly what's going on with me. And that I think it's like whatever, a few hundred, $400, I don't know the exact price
Yeah.
either. You know, that amount of money was like the best investment to know how to get you to reach your goal quicker. So while we, of course, tell you to make a decision based on your own finances, we're of course going to always recommend testing we think is important. And then you can then make that decision. And we say, hey, you can probably get results quicker here when we know exactly what's going on. So I agree with you. And the Dutch test is it's easy in the sense of you're just doing urine samples. For the Dutch Complete, that's not the cycle mapping, it's literally over 24 hours. It's 4 to 5 samples. If you don't wake up in the middle of the night to urinate, then it's literally 4 samples within 24 hours. The only thing my patients hate about it is that they can't drink coffee that day, so they're, like, miserable for 24 hours, but the coffee will elevate their supposed to elevate their cortisol, and I love the Dutch because it's giving that cortisol pattern. I did not know that the Genova did that test, what you just shared. That's great to know. But I love also on the Dutch, it has the organic acids, like you just said, the B vitamins, the neurotransmitters. It has a gut marker now, oxidative stress markers. And so I absolutely agree with you. So if money was not an issue, what would you say if a patient said, hey, I just want to get pregnant, money's not an issue right now, I'm going to do what it takes to get pregnant? What would you say are your non-negotiable tests if you didn't have a limit? Obviously, someone can say, hey, I have a budget. What would you prioritize? But let's just say there's no budget and you're going to say what you think as a physician and your experience with the best tests that could help you with the best data to help them.
Oh my gosh, I love this question. First, I would run a comprehensive blood panel through Quest through their insurance, testing for thyroid, insulin, blood sugar, all the normal things. But I think that our panels as naturopaths are more comprehensive. But if money wasn't an issue, I would absolutely be running either the Rhythm Plus full cycle map or the Dutch one, kind of depending on the patient's picture. But just some cycle map of some sort. I need to know what your hormones are doing throughout the whole cycle. And then if I and then I also want to know what your adrenals are doing, which is likely going to be part of those two tests. And then I definitely want to order a stool test like the GI map where I can see, do you have gut dysbiosis going on or parasites or viruses, H. pylori, et cetera? And how are those bugs or how is that inflammation affecting your hormones? Because if you have any of that going on, it is affecting your fertility for sure. And then last, if I didn't do a Dutch that had the organic acids in it, then I would probably do an organic acid of some sort. And that might include like a tox panel in it. Um, especially if I felt like toxicity was an issue. But so those three main ones: gut, a full cycle hormones, and an organic acid of some sort.
That's super comprehensive. I love that. I would do the exact same thing. And while all these tests can be fancy and there may be complex cases where some patients need longer treatment than others, I just want to remind everybody that sometimes just doing naturopathic medicine alone and giving the body what it needs is that simple. So it could be someone just needing iron and that's it. So, right, I just wanted to make sure everyone knew that while, like I said, some are complex cases that take a little bit more, there are cases where they just need to clean their diet up and stop eating so much sugar. You need to just get their thyroid functioning a little bit better or get some gut stuff worked out, and that's it. So I wanted to mention that because when you're doing naturopathic medicine, you're giving the body what it needs. And then, of course, when you're doing all these comprehensive tests that Cait just mentioned, then we're getting all this data to help you get those results quicker. And I did want to just mention one thing that has been challenging for me helping some women with fertility is a lot of them, because I don't know if you feel this way, but because a lot of times naturopathic doctors end up last resort because they don't know about us or they don't know that we're options. They've been trying so long through the conventional that they want to get pregnant really quickly and then they want to order all these tests. But I make sure to tell them, if you're going to order all these tests, if I find uranium, like I said before, or mercury, I had someone with really high mercury come up, or I had someone with the parasite, we need them to pause. They're trying to conceive because that's not healthy and safe for the baby to be doing that while they are trying to conceive. So I do share with them, if they want to do all these tests that can be an investment monetarily, they do have to give me some time to be able to help, or else those tests that you just ordered are kind of worthless because then we can't do anything with them, right? It's like if we find out someone has a parasite and then they don't want to kill a parasite and that's what's keeping them from being pregnant and they don't want to stop trying, then we come into, we come into an issue. So I'm very transparent and I say, hey, I'm happy to do all these tests that you're asking me to do, but are you willing to pause just so we can get rid of this thing safely if it comes up, right? We can do a lot of things for them while they're trying to conceive, but some things, like you agree, right? Detoxing uranium, mercury, arsenic, aluminum, or killing off certain gut bugs, we can't use those trying to conceive. So do you see that a lot with your patients where they don't want to stop, or, a lot of the times, thankfully lately, I get them saying, hey, I just want to be the healthiest I could be. Of course, I'll do that. I'll give you 3 6 months, or I'll give you a year, or that's an ideal answer. But do you run into that at all with your patients? Like not wanting to stop?
Yes, yes. But at the same time, what I like to encourage them is that, or what I would like to say to them to encourage them is that now that we have all of this information, and now that you're trying this different nutrient boosting holistic approach, you have more time.
Right.
Yes, because it felt like you didn't back then, because it felt like you didn't really have a lot of options. But I would argue now you have, like, I mean, I guess it depends on the patient and how old they are, but I would argue you have more time, and I hope that takes a weight off of your shoulders, because inevitably you will get pregnant faster and easier once we have fixed these underlying root cause things. But
Exactly.
it will
Okay.
take some time to do that. So,
Yes,
right.
exactly. Okay, thank you. That was always something I've come into issues with sometimes, because I'm like, I don't want people to waste their money on tests and then not be able to do anything with the results, right? So I'm like, if you're not going to do anything with the results, then we might as well not have you do tests, right? Because it's a lot of money to spend to then not utilize those results and create a very specialized plan. So I'm happy you agree with that. And did you have any like simple fixes, or do you feel like there are simple fixes like I talked about before where you're like, hey, it was just this one thing? So because I want to make sure people know it doesn't always have to be so complicated.
For sure. Um, so yes, I worked with a patient. I can think of one right now where, she had done Clomid and IUI and IVF. She had a miscarriage too. And, she really wanted to figure out what the root cause of her infertility was. And actually, this was back when I wasn't really running a lot of these functional tests that I just mentioned to you now. I think now I absolutely would have. Um, but, I was really working on more simple fixes with her, like you were just saying. So she also, again, was a patient who seemed healthy. And she was cycling every month, every like 28 to 30 days. She knew when she was ovulating. But when we dug deeper, and this might sound so simple to listeners, but honestly, this makes the biggest difference. She was skipping meals. And I felt like she was accidentally not getting in enough calories, and I felt like she was deficient in fat and protein. And so what would have seemed to have been a complex case given her history of IVF and IUIs ended up being pretty simple, because once I had her on a consistent nutrient dense diet, like eating consistently throughout the day, people don't realize how much that really affects your hormones. But once she started doing that and I had her on my fertility boosting supplement regimen, um, then after only 2.5 months, she was pregnant naturally. And she went on to have a healthy baby.
Oh my God, that's
I
so amazing.
know.
All she needed to do is eat. Like I just said to a patient
Yeah.
today, you're just, oh, I feel so much better. I'm like, yeah, because you weren't eating. So like just
Right.
sometimes as simple as eating. This woman the other day said to me that she heard online that she should be, so she's in her, I think her 30s, that she should, for her hormones, she should be skipping 2 meals a day, I think, and only eating dinner. I can't re something like that. I said, "Where did you
It's
hear
like
that?" So
literally the opposite.
literally the opposite. So she was literally eating, well, I'm so happy you brought this story because she was eating 1 meal a day, and she said to me on, like, this, I think I talked to her 2 weeks later because she's in my VIP program, so we talk every 2 weeks, and she said, "Oh my god, I feel so much better." And and literally all she did was eat. Like, you
Yeah.
just getting in another 2 meals. So that's incredible. So you're basically their health detective being like,
Yes.
"Hey, patient, I see you're not eating as much," because this patient, like you just said, she probably didn't even realize she was
Yeah,
getting.
yeah, she was a grazer, and
Yeah,
it's just like what she was used to doing.
yeah,
But
not
it
getting.
wasn't great for her hormones.
Absolutely. So we need those calories, of fat, the protein for our hormones, and oh my god, we have so much more to talk about. We're so over. So
Yeah.
what I'm gonna do, if it's okay with you, is I'm gonna just ask you a few other really important questions that I think are important, and then maybe we could just do quicker answers because we don't keep
Okay.
on listening for 4 hours because we have so much good information. But the herbs and herbal medicine and botanical medicine, obviously, as naturopaths, each person gets a different protocol. I don't even like to call it protocol, a health plan based on their unique needs. But have you seen any herbs being super helpful for women and fertility, just in general?
Yeah, absolutely. I love herbs. Herbs can be so powerful with normalizing your hormones, especially while you're getting to the more root cause factors. But I love Vitex, I love maca, I love ashwagandha, and I love a product called Utericom. And it's yeah, it's similar to the one that you and I have talked about before that is helping to prevent miscarriage risk. And so obviously, it's not a guarantee, but I feel like so many women out there who've experienced the heartbreak of miscarriage don't realize that herbs can help to basically tone your uterus, get your uterus ready for pregnancy, for implantation. And this one in particular is designed to help prevent miscarriage. So point is that there are so many amazing herbs out there, and they can absolutely be helping your fertility. They can help to decrease your miscarriage risk and to balance your hormones.
Love it. And you also feel that acupuncture can be really a good adjunctive therapy. I love acupuncture personally. Me and Dr. Cait were on an acupuncture clinic shift together in medical school because in Arizona, you're licensed, you can do acupuncture in that state. So we were trained in acupuncture and I loved it. And I tell people all the time, you can get acupuncture if you can afford that. That would be great to add on to our naturopathic plan. Do you agree?
100% for sure. Yeah.
Yeah. So you're a fan of acupuncture too. And then just another last few questions. Do you have your couples use any devices that you feel are helpful for tracking ovulation? Is this helpful for them at all?
So, long story short, I find that cycle tracking apps are usually not accurate in predicting ovulation, and that this is often a problem for women because they think that their phone is telling them when they're ovulating, but no, f- you can't. No app can tell you when you're ovulating. You can only know when you've ovulated after the fact based on a spike in your basal body temperature. Or, I mean, I guess if you were at the doctor, they could tell you when you're ovulating, but um I think that this is important to know because every woman ovulates at a different time. Not everyone is ovulating at day 14, and every cycle is different. So you could ovulate day 15 one cycle and day 16 the next. So, long story short, I am typically working with the fertility awareness method when I'm working with clients, and I like the Ovograph app, which helps them to track their basal body temperature and their cervical fluid and potentially cervical position too.
Love that. Okay. So that's super helpful, I'm sure, for couples to know. And to wrap it up, I did want to mention that patients can come to us wherever they are in the sense of if they've done IUI or they've done IVF or they're looking to help with egg quality. So we can help pretty much right? Would you agree throughout any of these processes, whether it's just one completely natural or, hey, I want to go get IVF and, I want my egg quality, for example, I want to have the best egg quality possible. I actually wanted to share really quickly. I had this one patient say, hey, can you help my egg quality? I want to get IVF. I said, sure. So I did the things that I felt was helpful for egg quality and dietary changes and antioxidant rich supplements and foods and all of the things that I felt would be helpful for her. And she ended up getting naturally pregnant and she didn't even need the IVF. So I
That's
love that,
amazing.
right? I love that story because just by supporting her body, she ended up getting pregnant, didn't need to go through an invasive procedure. If she needed that, then of course, then we would have at least been one part of her journey. But I wanted to just mention that. And I don't know if you have anything to speak on that, as well as any other last words of wisdom or hope that you can give for others, or anything else you want to share regarding any other patients you've seen.
Yeah, I think that for my final words here, it's don't give up hope. There are answers and there are solutions, especially if you're willing to dig a little bit deeper. And, naturopathic functional medicine truly have so much to offer. Um, and, infertility is really just the sign. It's the signal of a deeper imbalance, and that's okay. Everyone has an imbalance going on in some way, right? It's just figuring out what it is so then we can reverse it, then we can heal it. And I think that, you'll be healthier because of digging deeper and healing your fertility, and your baby will be too.
Oh, amazing. Oh my God, I love you. Thank you, Dr. Cait. This was so informative. People are going to love this podcast. I
Thank
want to
you so much.
Of course. I want to remind you guys you can follow Dr. Cait on Instagram at dr.cait, Cait. Also, you can look more into her Instagram and also her website. I'm going to have her give in a moment. She has her Get Pregnant Naturally membership program that she talked about at the beginning. And Dr. Cait, can you share your website with them as well?
Sure, it's just drcait.com, drcait.com.
Perfect. Thank you so much for being here. This was so awesome, so informative, and thank you for helping so many women get pregnant.
Thank you, Sue. So good to talk with you. Bye.
Thanks so much for listening to Modern Day Naturopath Podcast with Dr. Sue.